Welcome back to the channel. Today we're diving into new findings from ACR Convergence 2024, and this one's all about Sjögren's disease. Specifically, the presence of organ-specific autoimmune conditions in patients with primary Sjögren's. Let's get into it. Sjögren's disease, or SJD, is best known for attacking moisture-producing glands, but it's far more complex. This study, presented by Dr. Gabriela Hernandez Molina and Dr. Ariel Garcia Torralba from Mexico City, aimed to investigate something deeper: the connection between SJD and other autoimmune diseases that target specific organs. Researchers reviewed the records of 328 patients seen at a tertiary referral center. They looked for autoimmune conditions in the gut, blood, nervous system, skin, kidneys, and endocrine organs. That includes things like primary biliary cirrhosis, autoimmune hepatitis, vitiligo, myasthenia gravis, and autoimmune thyroid disease. Here's what they found. A little over 31% of patients with Sjögren's also had an organ-specific autoimmune disease. The most common, autoimmune thyroid disease, followed by PBC and autoimmune hepatitis. Interestingly, these conditions didn't always come after the Sjögren's diagnosis. In some patients, they came before or were diagnosed at the same time. When comparing those with and without organ-specific autoimmunity, most features were similar: age, sex, symptoms, even disease activity scores. But here's the twist. Patients with organ-specific autoimmunity had a lower rate of anti-Rho SSA and anti-Ella SSB positivity. Also, they were less likely to be treated with methotrexate. In fact, regression analysis confirmed it. The presence of anti-Rho SSA antibodies and the use of methotrexate were both inversely associated with having another organ-specific autoimmune disease. In other words, if a patient had anti-Rho or was on methotrexate, they were less likely to have another autoimmune organ condition. So what's the takeaway? Roughly a third of patients with primary Sjögren's disease also carry another autoimmune disease affecting a specific organ, with endocrine involvement leading the way. Clinicians should be mindful. These diseases can show up before, after, or right alongside Sjögren's, and they might behave differently depending on the patient's antibody profile or medication history. Thanks for watching. If you found this helpful, drop a like and share it with your room team. And if you want more deep dives from ACR 2024, hit that subscribe button and stay tuned. See you in the next one.